Thank you so much. Yeah, great to have a backup option. So, and then yeah, Megan, it looks like people are still joining. If you can keep an
Oh,
eye on the waiting
okay.
room. Cool. So yeah, thank you everyone for joining. We are so excited to host our fourth statewide meeting of the year. We weren't sure if we would have a fourth, but there actually was a lot of interest at our last meeting. And then we had almost 70 folks register for this meeting, and a ton of you have joined. So thank you so much for wanting to be part of this conversation. Yeah, thanks, Amy. So yeah, if you want to go ahead and you know the routine, stick your name and contact information, whatever you want to stick in the chat for everyone else on the call. And then it also is National Family Caregivers Month, which is a big deal for us. We're going to have some great events, or we're going to be promoting some events throughout the month. And Allegra Mangione is actually on the call. She's been working with our organization to help get the word out about not only National Family Caregivers Month, but all of our everything we have to offer throughout the year. So thanks, Allegra, and thanks for being here. And then, yeah, I'm just going to quickly go over the agenda and kind of why we're here, and then hand it off to Megan and our panel. We have a great panel today of experts that I'm sure everyone here is very familiar with. But if not, you will get to know them and get to know how they support respite care in Colorado. So yeah, we also have a regional coalition meeting coming up next week. It's the Western Slope meeting. Sandra is not here today. She's out of the office until tomorrow, but if you want to, I'll stick some information in the follow-up email about how to register for that meeting if you are interested in attending. It is in person at the Food Bank of the Rockies out on the Western Slope, and also virtual. So two ways to join. And yeah, so Amy, if you want to go ahead and go to the next slide. Oh, so yeah, regional meeting coming up November 9th. I guess also, Megan, if you just really want to talk about new adventures really quick and what's going on in the Southern, our attempt at building the Southern Regional Coalition involves Megan's new project, New Adventures.
Hi, so New Adventures is a Saturday respite program for children with disabilities age 6 to 18. And we just had our first session last week, and we had 3, but only one person ended up coming. I think it's just a new program, but we're trying to break into that area. And and if you're familiar with our Discovery Club, it's just like the Discovery Club that's in the metro area. So, and our next one is November 11th.
Yeah, so yeah, thanks, Megan. We're very excited about that. And if you have any questions about regional coalitions, reach out anytime. Go ahead, Amy. We can go to the next slide. So yeah, we just wanted to take a second before we launch into our panel to talk about why we want to have this conversation and why this conversation is important. It does tie back to goal 3 of the national strategy to support family caregivers. These are goals that our program focuses on, and we work with Arch National Respite to have a lot of these conversations and work towards how work that our program does can contribute to these national goals. And why that's important is, Amy, on the next slide. We wanted to bring this up on this webinar, even though it's kind of a topic that isn't ready for a broader discussion yet, or at least we decided we're going to wait until later in 2024, unless there's anyone on the call who has more information about this news and this new development in the kin-specific foster world. But anyway, we just wanted to let folks on this call know that we are aware that some work is being done at the national level to make progress for kin foster placements. We hear a lot. So Colorado Respite Coalition hosts a respite weekend for foster, adoptive, and kinship families once a year. And this is something that we've heard from the families that we work with. So to see this work being done on the national level is really encouraging to us. And we just want folks to know that it's happening and that we'll continue to keep an eye on it and share news and share developments as we can. So yeah, Megan or Amy, do you see any hands raised or any comments in the chat or anything about this?
No.
Cool. Cool. So yeah, in 2024, you can look forward to more news about that. We hope. So yeah, from there, Megan, I will go ahead and pass it off to you to kick off our panel session.
Okay. Oh, bless you. Okay, so today, as Erin mentioned, we want to talk about respite care in Colorado. So we've asked a few of our colleagues to join us for a panel today. So if what we'd like is that we're going to have a group participation, but after we ask the questions. So yeah, so we're highlighting stories from the industry, and we would like you guys to input after all the questions are done. So next slide, please. So here are our panelists. And I think maybe Tia's not on yet, but
I thought I saw her join actually.
Oh, okay, sorry.
I'm here.
Oh, good.
Cool.
Great. Thank you.
Yeah.
Okay, so what we're going to do is do a round robin kind of introduction for the panelists. And so we want to introduce yourself and tell us about the status of respite from your program's perspective. And I guess we can start with Tabby.
I'm Tabby Wiest, and I am the program manager for Hilltop Senior Daybreak Program. And we are an adult day center that provides that daytime respite for families in the community that are keeping their loved ones in home and out of facilities for as long as possible. Our primary demographic is folks with dementia, Alzheimer's, as well as medically fragile individuals. For us, we really only provide respite during the daytime. And so I think what we're really seeing in our community is an absolute need for overnight respites to really give those caregivers a break. And unfortunately, a lot of our care facilities within our city, they don't have open beds that are just kind of open for emergency respite or that PRN respite. And so that's kind of an area where I think that there's just kind of a gap of service there. So would love to be able to chat more about that within this this group.
Thank you, Tabby. That's great. Tia, would you mind going next?
Sure. Hi, everybody. I'm Tia Saucetta. I'm the Director of Respite and Caregiver Services at Seniors Resource Center. And we provide an on-site adult day program here in Wheatwood, serving really the Denver metro area. People come from all over to our program. And we also specialize in individuals living with Alzheimer's and dementia. That does not mean 100% of our folks have Alzheimer's or dementia. It's just our specialty. We do serve older adults, so 55 and older. And we've, been doing this for forever. It feels like I've been doing this forever. I love adult day, and I think it really does provide people with that daytime respite so they can go do the work that they need to do, or maybe go take care of themselves. Let's hope. But I would agree with Tabby. I think in addition to that, we know they also need some support at home and evenings, weekends, things like that are challenging for people to just live their lives. I think could be really potentially helpful to them. I do also want to just mention, I think depth of service is really important. A lot of times with funding, people are like, well, we want to serve as many people as possible. And I understand that. Certainly I do. But person coming to adult day 1 day a week does not have the impact that someone who can come 3 to 5 days a week. That builds routine, that builds continuity of care. and it allows that person to age in their home for much, much longer and gives that caregiver a true lifeline. So that's kind of my message these days.
Okay. All right, we already have a question. So Jillian, would you care to go next, please?
That's great. Hi, I'm Jillian Brose, and I'm with the Weld County Area Agency on Aging. So we serve kind of for Weld County services, serving older adults or those who have like a neurological brain dysfunction or dementia diagnosis, something of that nature. We administer the Older American Act Caregiver Respite Grant in Weld County. We've chosen to do the consumer-directed model, and it's really a great model for our area because in Weld County, if you're familiar, it encompasses a lot of different demographic areas. We have frontier land, we have rural, we have more kind of metro in our bigger cities. So the consumer-directed model we found really works in every community. It allows the caregiver to use those informal supports. So a friend, maybe a family member, somebody they're familiar with, as well as accessing other services like adult day program, in-home health care, kind of fitting the need for each family. The consumer-directed model, at least in our county, really works well. We are seeing a larger increase in requests for service. So historically, we've had periods where we've had waiting lists, then we didn't. We're consistently seeing a waiting list across the board where we're not able to serve everybody we would like to at one time. So that's kind of what we're seeing coming out of the pandemic, is just an increase of services for a variety of reasons. It could be the increase in care costs, could just be family dynamics have changed, maybe a loved one's back in the office when they were at home prior to that. So I think for us, kind of the biggest struggle is just meeting all of those needs.
Thank you, Jillian. Erica, would you like to go next, please?
Sure. So hi there, I'm Erica DeBray. I'm the manager of the Aging and Disability Resource Center at the Area Agency on Aging at DRCOG. So we serve the Denver metro area, which is 8 counties, Broomfield, Adams, Arapahoe, Douglas, Clear Creek, Gilligan, Denver, and Jefferson. What did I forget? I think I got them all. So our caregiver and respite program is brand new. We just have 2 folks who are on this call today who just started this summer with us, and we're working to develop our caregiver and respite program. We're going to be serving, we use the Older Americans Act, so we're serving 3 of the 4 populations through the Older Americans Act, so mostly older adults or caregivers serving people with disabilities 18 or older. We will not be doing kinship caregiving, though we do fund Catholic charities to do that in our region. So our respite program, we're hoping to really get that started in the next calendar year. We're going to be focusing on consumer choice with a voucher model, and folks are going to be able to choose either in-home care, respite care, or adult day center for respite care. And we're going to have a huge emphasis on caregivers who are going to be attending our education classes for caregivers. So we're really excited to roll this out. So we're going to be ramping up in the next couple months to get everything started, to start offering powerful tools for caregivers and the Pearls program for caregivers as well here in the Denver metro area. So we're very excited about that. We've definitely seen through our information and assistance line quite an increase in calls from caregivers. Just this year, between 2021 and 2023, we've already seen an increase of over 7 times the amount of calls that we got in 2021 versus what we've already gotten so far in 2023. So it's definitely ramping up, and it's going to be a highly sought after program I'm anticipating for our caregiver services. So there's not that much out there in the Denver metro area. We serve quite a vast landscape in our region between the rural areas and having in the cities. So there's quite a lot to balance between serving all the different populations here at DRCOG.
Sorry. Thank you, Erica. Kelly, would you like to go next, please?
Hello, everyone. Good morning. My name is Kelly O'Connor, and I am an elder care consultant. I have a private agency, and so I do a lot of referrals to your communities and programs. So I just wanted to say thank you so much for all that you do for family caregivers. And so I work exclusively with older adults. The primary work is people with dementia of some sort. And so I'm really looking forward to being here. The one thing that I've seen as far as big changes are concerned is a lot of the private pay communities have extended the period of time required for a respite stay, because we do residential respite stays. And so where you used to be able to go and do a 1-week stay or a 2-week stay, many communities are now requiring 4 weeks, a 30-day respite stay. And so that's been one of the big changes that I've seen post-COVID. And so with that, I'll turn it back over to Megan and look forward to answering any questions that you have about private pay and older adults.
Thank you, Kelly. Corinna is going to go next for HICPUF.
Good morning, everyone. My name is Karina Barrick. My pronouns are she, her, and I'm with Healthcare Policy and Financing, also known as HICPUF. I'm joined here by my two colleagues, Emily Welsh and Karen Stewart. And at HICPUF, the role we play is to manage the respite benefit for Health First Colorado Medicaid members who are enrolled on a home and community-based waiver. So we ensure that respite on waivers is being provided in accordance with regulations. We support members. I apologize, I have a barker, if you can hear that. We work with case management agencies, providers, and stakeholders to access the respite benefit. Respite is available statewide on 8 waivers, both for children and adults. And we recognize that there is a provider shortage across the state, and that affects many different services, including respite, and the provider shortage and the respite rates are challenges. I'd like to again introduce my colleague, Emily Walsh, who has worked at length with this respite benefit. Over to you, Emily.
The
Thanks,
Respite
Karina.
Coalition, and there's like...
Hi, everyone. I'm Emily Walsh. Like Karina said, I work with the respite benefit at Medicaid or Health First Colorado. We're really excited to be here with you today to share some information and to hear from you all about what you're seeing in the communities that you're in terms of respite. We recognize that there's a demand for respite across the state, and that demand looks different across our different waivers. We see at HICPUF the highest demand on the Children's Extensive Supports waiver, and that can be for a variety of reasons, having to do with access and things like that. But I will turn it back to Megan. We're excited to talk to you all today.
Thank you, Emily and Karina. Okay, so we'll go ahead and get started. So we're going to start with day programs, if everyone's okay with that. So the first question is, how have day programs changed? And are clients still able to drop in as needed? Do you use a care coordinator? And if so, what purpose does that role serve? And what benefits do they provide to the caregiver? And are you having to deny anybody? So thank you, Erin. So I guess I can call on Tabby or Tia, if you would like to speak to that, please.
Sure. Tabby, do you want to go first or? Okay. Thanks for putting that in the chat, because that's definitely some good questions, but I want to make sure I answer them. I think, day programs have changed a lot over the years. I have been in day program for over 25 years, and I've seen a lot of change. Honestly, right now, we need providers. We're losing providers. There are not many around. And I always tell people, if you've seen one adult day, you've seen one adult day. So we need quality, good providers out there providing adult day. I think this is very prominent in Colorado. Other states have hundreds of day programs to choose from. In Colorado, we have a lot that are focused on younger adults or people with individuals living with, disabilities, but the older care, the older senior population, not as much. So I continue to see my colleagues close their programs, and it's heartbreaking. So I would love to see more people get into this. I think it is the future. Tabby, I don't want to just talk all the way through, so please join.
You're good. I don't have the experience that you have in adult day. So 25 years, that's really awesome. But I do see that there's a lack of programs available. And for us over here, I'm located in Grand Junction, Colorado. And so for us, it's really, we are it. Our one program to serve the elderly population is all we have over here. We also have the PACE program, which we have one over here, but that doesn't provide services for veterans because they only really accept Medicaid. They do accept Medicare, but then there's a private pay cost that is really huge for low-income families to be able to afford. So I think, yes, some more services would be greatly appreciated, as well as just being able to get out there. I think that a lot of folks don't even know that we exist. And so we have a lot of caregivers who are in the home struggling. So how do we partner with like 211 and those other, we have ADRC over here. And so how do we partner with those programs so that when people are needing help, they know where they can go to reach out for that help so they can get pointed in the direction that they need to. I think a lot of frustrations for families is that they have to navigate through a lot of bureaucracy in order to be able to obtain the services that they need. And that can be very frustrating if you are feeling like you are in crisis and you are needing that break. And so how do we make it easier for them to be able to get the information that we need, but also to be able to help it simplify it as much as we possibly can. So I think that's the change that I have seen, is that there's a lot more paperwork involved. There's a lot more steps involved to be able to get the services that they need. So how can we streamline that for folks and make it easier for them to obtain our services?
Yeah, I would agree. I think one of that leads into number C, or letter C. Do we use care coordinator? At SRC, we do. Every participant, every client uses or is has access to, but really utilizes a care manager. So our care management program is throughout our whole agency. So no matter what service you get, you have a care manager who helps you navigate that. And we have seen that be highly, highly successful. People need assistance. For most people, adult day, respite, this is I always tell people, it's like your very first toe dip in. You're like, whoa, this is a lot, And so they need that support. And so adding the care manager, we've always had care managers, but we realigned the work that they do and made it very consultative so that people have access to this expert, to these resources. And you don't know what you don't know. So the care managers really help with that. I think that has been a huge change in our ability to serve people, as well as more holistically serve people. We're not just serving one need. We're able to then, utilize the resources that we have to connect and bring people more resources. And here's the reality. You have to have a wraparound of support. You need people who can come in your home and help you. You need a place to go during the day. You might need, food assistance. You might need energy assistance. And so it's that whole piece. People are whole people. They don't just need help with just one thing. And so I think that our care management model has really, really affected that in a positive way. But it doesn't mean it's not still hard, Tabby. It is for some, especially Medicaid and all those other entities that they have to navigate.
Yeah, and we're also seeing a lull in being able to get into a provider to get the basic assessment paperwork done. Doctors' offices are so slammed that some of our folks are 30 days out before they can even see a doctor to get like their MOST form, their advanced directive form filled out, to get a health inquiry form filled out, to get an updated med list. And so if they're 30 days out from even seeing the doctor to complete the paperwork, then we're seeing that lull in service where they can't get the respite that they need in that time frame.
Yeah, it's a lot of dotting the I's and crossing the T's that can get really tedious. And to Gabby's or Tabby's point, like they're in crisis usually. So and also to play off what you said earlier, I think that this community, this group, we are the voices that need to be saying, have you looked in adult day? Have you tried this? People don't know. And so before they get to crisis, you got to start telling about it, because they need to process it for 6 months before they need the support. I mean, not always, but a lot of folks really, in all of my years of doing this, one time, and I'm not exaggerating, I have had somebody come in and say, I think I might need this in my future. I want to learn about it now. In 25 years, one person. And so we have to change that as a society, as a workforce, as a community. The other couple questions, can people drop in, and do we deny anybody? I'll speak from for us. You have to be enrolled in our program in order to attend. So you cannot just drop in that sense. But once you go through the enrollment process, we're pretty flexible. We have changed a few things along the way to be able to better support in our clients. And so we do ask that they set a schedule, but we also know life happens and they are dealing with a lot of different things. And so if they call and say something, my schedule changed, I need to bring mom today, or I need to bring my person today, we make it happen. But we do need to have some basic information first so that we can provide a high quality of care. That's all that it's about, is we need to be able to provide that highest quality of care. And because we specialize in individuals over the age of 55, certainly that is our, people who are younger than that aren't somebody that we are able to serve in this environment. I do not like to say, there's this or this that would disqualify somebody, because what I've learned over the years and working with people is you just never know. The person who wanders every single day at home might come to adult day and just be so busy and enjoying their day that they never look for the door. The person who has never ever been an exit seeker at all might come to adult day and be really, really nervous and uncomfortable and need lots of support. And I have thousands of stories of how we do that. And so it's not a hard and fast rule for us.
Yeah, I think that ours would be the same. Because we're such a small program, I can actually only accommodate 28 individuals. And so as we're filling up pretty quickly, I think that our flexibility around drop-ins is definitely decreasing.
Sure.
And so families are aware of this. We definitely encourage them to have a set schedule, because routine really helps with the demographic that we serve. And so having a routine schedule is definitely ideal. But of course, like what Tia said, life happens and things change. And so as we're able to be fluctuating right now, because we're not at capacity, we're able to offer that flexibility. But once I reach capacity, that's going to become less and less. And unfortunately, I don't have another program to point them in that direction. And I think that's where I see my concerns for the future as we move forward and I start to fill up and advertise more. And so I think that it's just, it is difficult, and we don't use care coordinators. We really are by referrals and word of mouth. And we really partner with Rocky Mountain really closely, because they have their single entry points to get people on Medicaid and to be able to help navigate those systems. And so once I reach capacity, I worry about the folks in our community and starting a wait list and those caregivers and the stress that they're under currently. So it's really difficult, especially over here on this side. I think more programs over here are definitely needed.
Yeah. And I think and I don't want to go too long, Megan, so if you need to give us the hook, go for it. But Kent put in the chat that, you know, adult children, spouses, a lot of people don't think of themselves as caregivers. And so I really, you know, one of the things that is really important to me is if you take care of the care partner, you're taking care of the person. If you take care of the person, you're taking care of the care partner. And so it's a lot of education, and it is, you know, really, labels are hard. We internally in this field have a lot of acronyms and labels that we use, but at the end of the day, a lot of people are like, I'm just the daughter, I'm just this, I'm just that. And so it's education. And one of the things that I have really zoned in on and focused on is helping people protect that relationship, right? So I want you to be their daughter. I want you to be their spouse. So as a professional, let me handle this. And that allows you, when they go home after they've had a great day in day program, when they go home, now you can be the daughter who's like, hey, how was your day? What did you know, and not that they're necessarily going to give you the list of what they did, but you now had something of your own. They had something of their own, and you can come together and be that in that family. And so, yeah, it's healthy boundaries, but most people, first of all, most people in the world don't have healthy boundaries. Then when you're thrown into a caregiver situation, you don't have the luxury of even thinking of this. So we have to educate people. We have to help them protect that relationship. And it's with services. So in-home care, let someone come give your person a shower so that you're not that caregiver. I mean, I know this is not going to work 100% of the time for everybody, but I do think it's where we should focus some energy in terms of education. So I fully agree, Ken.
Yeah, I agree. The duality of service is definitely important. I run a support group every month just to bring families together to create kind of a community so that they can share their experiences, because their experiences are definitely similar in how they're caring for their loved one. And so bringing them together and creating that sense of community, it also gives them resources. At our last meeting, everybody exchanged numbers and said, hey, call me if you're feeling stressed or you need a place to vent, like, oh, if you need a resource. And so they really collaborate with each other as well. And so that duality service is super important. We have to support the caregiver as much as we support the participant, because they are the ones that are in it. And 9 times out of 10, they're waiting for placement. And so they could be 6 to 8 months out from placement. They need that service in between to keep them going, to keep them in it, to provide that care for their loved one for as long as they possibly can. And a lot of our families will overextend themselves, and they will keep the loved one in the home far past their capability and what they're able to provide, because they just want to be there as much as possible. And so how do we support them in the meantime and to stay in it for as long as they choose to stay in it?
Sure. Yeah.
I'm going to address a couple of questions, and then if anyone wants to jump in and answer. Or so first one is, what ideas are there for increasing the respite care workforce, and any ideas why Colorado falls behind other states on this? Anyone have an opinion?
I have lots of opinions.
Oh.
Why does Colorado fall behind? I don't know, really, truly. On the East Coast, I think there is just a little different landscape in terms of providers, and you know, part of its population, right? Like densely populated areas versus, you know, spread out areas. It's a lot easier to serve more people in an adult day when they all live in this little area. Here in Colorado, we know transportation is a challenge, so getting people to and from our more spread out footprint, I think, is part of it. I don't know the other reasons, but I think that's part of it. And then the workforce, I'm huge on the workforce. Anyone who knows me knows that I've been fighting this fight for a long time. We have to pay people more. We have to elevate what they do. It is a chosen career. It is not a default career. And the people that work for us are our best and greatest asset and resource. And so we need to invest in them. And in the time that I've been at SRC, we have nearly doubled people's wages for our direct care staff. And we're still going. We're not done. Like, we have to keep working for that and making this a job that is desired. And I think, you know, we as individual organizations and people in this field have to continue to push for that. So
Thank you, Tia. Anthony, did you have a question?
No, I'm hitting buttons.
Oh, okay. Oh, all right.
I was clapping for what she said, and I'm hitting buttons. I'm sorry.
Okay, that's great. Thank you. Okay, so another question from Darlene is, what is being done for high needs adults with disabilities in the West Denver area? We could just probably say throughout Colorado. Day programs keep turning down families with young adults with high needs behavior, medical needs, autism, or a rare diagnosis. Community center board case managers not aware of day programs and taking these high needs clients. Anyone have a comment on that?
I would agree with that. So prior to me taking over this program, I spent 7 years working with adults with traumatic brain injuries under our life adjustment program. And we did, for a period of time, run an adult day program within that residential program. And I think it was difficult for us. The only way we were able to do it is because we had the infrastructure of the residential program to be able to accommodate the day program. Once we weren't able to do that because COVID hit and the state really was wanting us to separate those two out, it became difficult for us to manage a own separate alone program because we only had about 4 or 5 participants in the community that was utilizing it. And so unfortunately, we had to close the doors to that program. It was also difficult for staffing. We were using the staff from the residential program to be able to staff the day program because we just couldn't find folks that had the skill set, the patience to be able to work with a highly behavioral population. It's not a job that people are willing to step into, is what we're finding. And so that, I think, is the biggest difficulty, is that we have a younger generation that is coming out of school, nursing school or CNAs, and they don't want to enter into that dynamic and working with those high behaviors because they're not trained to do so. There's no in-between training for that within what they're doing in college and what they're doing for just basic CNA training. And so there has to be that in between, like, what are we doing in that education period to say, okay, and this is your behavioral techniques. Here's your crisis prevention and intervention training on how to keep yourself safe and keep the client safe when you're experiencing a behavior. And so they shy away from it because they've never known it. They don't want to get involved. And again, to Tia's point, the pay. You really have to make sure that we are paying these folks because it is a difficult job that they are stepping into in serving that highly behavioral population.
Thank you, Tabby. Karen Stewart, did you have a question?
I did not have a question. I just wanted to interject a little bit. So Karen Stewart with Healthcare Policy and Financing. Because we're talking about the workforce piece, I wanted to share a little bit about where Healthcare Policy and Financing put a bunch of funding into looking at direct care workforce and trying to strengthen that. What types of activities needed to happen to help strengthen the pipeline, identify what some of these challenges were. And I'll end up putting a couple of links in the website just so you can do some research after the call. But when I asked the gal who oversees our direct care workforce ARPA project, I asked her for some information to share at the meeting today. And she said that a recent evaluation of the home and community-based services workforce identified that 45% of current direct care workforce is 45 and older, and 85% of the workforce are women. So when you look at those statistics, I think that also impacts who's showing up to do this kind of work and what supports are needed. So those add a lot of different dynamics, trying to tease that out and support and maybe attract and broaden who wants to do this work is important. So in order to meet the diverse needs of the members and participants needing respite care, you have to look for ways to also expand the diversity of the workforce. So some of the things that they're trying and strategies they're working on is building out a job matching site to streamline the job search process for potential direct care workforce providers, which hopefully has a reduction in the cost of those providing the care in those recruitment costs. If you can take some of those steps out of all of your advertising and trying to recruit, how much time do the folks around the call spend on just trying to recruit more folks to do the work. But they've also, so developing standardized training, there's a lot of opportunity for training dollars. We were just speaking to that, some of those specialized training needs. This would be above and beyond just normal onboarding, but specialized training to meet the needs of those that you're providing care to. There's supporting higher level training opportunities in addition to in addition to the education piece, those specialized skills, where then you can justify paying a higher amount of salary for those specialized, and maybe those are transferable. So if there's a way to get those training needs and you become kind of a expert in that particular support, that makes you very marketable, and so that might attract people to the field as well. Anyway, there's a lot of information. I'm not going to take up a lot of time on the call for this, but I wanted folks to know that there is a lot of work being done in the direct care workforce. There's a collaborative, folks can join in on those calls. You may already be aware of it and part of that, but if you're not, I will put those links in there for you to research later, and you can always reach out with questions too. So, thanks.
Thank you, Karen. I'm just going to read a couple of comments, and then I think we'll move on to
real quick. I wanted to chime in on something that I heard from someone who used to work in direct care. I was a direct support for people with disabilities. And it went all the way from elementary up to adults. And I did this for several years. And to the point of what some of y'all are saying, one of the things that caused burnout was me being a big man. I had to take on the harder cases. They had me dealing with the more violent people, and the pay didn't match that. And when I tried to talk to the people who were up, there was that disconnect that they wouldn't hear what I was saying, even though I was the one with direct interaction with these individuals. And so nothing was being done about that. And there was no money that came to even try to even that out. So eventually I left the field, and that, my wife even was like, you can't do this anymore. This is not worth it. Cause I'd come home with scars and scratches and there's nothing to show for it. And nobody that I was working for higher up, even they just a little pat on the back and be like, yeah, thanks. We appreciate you. But there was nothing else being done to help support that. So that's one of the reasons why from my standpoint, and some of the people that I work with have left the field because of burnout, because they didn't feel supported. So that's another area to address with this.
Yeah, thank you, Anthony. Okay, so let's see, let me go back here. Okay, so sorry, back up here. So this is from Diane. We manage a volunteer-based respite program here in Larimer County for people caring for older loved ones at home. While our volunteers don't do any hands-on care, they are caring neighbors and not medically trained staff. They do fill a need for families who just need a break and someone to be there for their loved ones so that they can take care of their own needs. We feel this model is really underutilized statewide. And that's actually something that Colorado Respite Coalition is exploring as well. So we would love to talk to you. Let's see. Okay, and then Teresa says, is there anything being done in Colorado to increase availability of day programs, specialized habitation for IDD folks. In Colorado Springs, we are extremely limited in quality programs. And anyone have a, okay.
And so I'm wondering, maybe it's a great question, Teresa. At Health First Colorado, day program is its own service separate from respite. So Erin and Megan, I'm wondering if maybe in the future we might want to tap into our the benefit specialist who oversees that benefit at Medicaid and have them come to a presentation so they can kind of speak a little bit more to that.
Yeah, that's great. Thank you, Emily. Yeah, love that. Okay, so I'm going to move on to the navigators. We have, well, I have Kelly. Not to put all the pressure on you, Kelly. I'm just going to throw the questions out, just answer what you feel like you want to answer. So navigators, are you finding that respite providers have availability? We're kind of talking about that. Have the requirements changed? Longer minimum visits? Well, we have that too. Have providers gone out of business or have new ones gotten started? Are there particular populations that have more or fewer respite resources, such as older adults versus families with disabled children? And how are respite vouchers working for providers? So can you speak to any of that, Kelly? Oh, and Erica.
Yeah. Yeah. So as I said, I'm Kelly O'Connor, and I work with older adults in the respite program. And what I have found is that we are doing placement into assisted livings and nursing homes. And so what we found is that there have been some providers that are changing ownership and operation, and that's caused a little bit disruption to services. As I mentioned earlier, there is an increase in the requirement, which increased the cost to families. So when you're having to pay for a 4-week respite instead of a 1-week respite, that's a significant amount of money. I think for the people that do have financial resources, I do think it speaks to them in being able to take a 4-week respite rather than a day respite or a week-long respite. It really does allow the caregiver time to regroup and rejuvenate. So that's my general comment for right now. I'm open to any questions that people have.
Jillian or Erica, do you have anything too that you might want to speak about?
Yeah, I mean, at this point, I definitely think it's hard for folks to find respite care, and it's either a lot or you're not going to get much. So I think our INA folks, our information assistance folks, have found like, oh, I had an acute illness and I can't meet this level of care for the person I'm caring for. I just need short-term respite. Not always are they able to find intermittent respite care, or the agency that can do that is requesting significant hours, which sometimes financially is not feasible for that individual to be able to pay. So they end up in this weird, like, well, I don't want to send them to higher level care because it's only short term while they recover from an acute event. But at the same time, they're like, I also cannot do this level of care in the home, and they find themselves stuck between the rock and a hard place. So I definitely find that is something I've seen for a long time and continue to see. Definitely there's been a lot of changes in providers out there, especially in the Denver metro area. I'm specifically finding like adult day centers are closing unless you live in Aurora, and there's a lot of choices in the Aurora area. But for folks that live very far on the west side, driving all the way across town is not going to be a reasonable thing for when you're looking at respite and adult day. And then the cost of in-home care is just continuing to increase. And then sometimes when you're looking at short-term respite care, the costs may sometimes be a little bit higher to be able to fill in those gaps because that agency knows it's only short term and it's not a long term. Though hopefully in the conversations I've always had with folks is you need it short term, but it's also good to have it ongoing as well, and to develop that relationship with an in-home caregiver agency, because you never know when another acute event might happen. And then you're already set up with that agency, and they're familiar with the person they're caring for, and they can provide more if something were to happen again in the future. So it's one of the conversations I've always had with folks and caregivers, and saying it's not a bad idea to even just have a little bit ongoing, just so when something happens, you need more, that agency is there for you.
Thank you. Jillian, do you have anything?
Yeah, we're kind of seeing here in Weld County the same kind of situation that the other two individuals shared. We're seeing longer minimums for visits. So some agencies are requiring kind of a set schedule. I need you one time a week at the minimum for 4 hours. Some of them are. The way we're kind of, I don't want to say getting around that, but we're dealing with that situation with our respite vouchers. We have a lot of families who utilize just the in-home care, meaning with a home care agency, for those situations that they know they're going to be gone for a long period of time, and they're filling in the gap with more of those informal supports. So like a friend, a neighbor, somebody they're familiar with that they know can handle their loved one's care. So we're trying to be creative in helping to kind of meet that need for that family. We are having more families having to pay out of pocket beyond like what our respite voucher will pay for. But what I'm finding over the years is more and more families are more willing to that once they experience what respite care is like, and they see the value in that. And so they're finding ways to kind of pay a little bit out of pocket for that, while our grant supports the remainder piece of that. And the only other thing I want to mention is with the provider shortage, we know that's the case across the board. We are seeing it hit our rural and kind of frontier areas the most, because agencies are not able to find providers who will do the transportation for 45 minutes to get there, stay there for 2 hours, and 45 minutes back. So we're finding that is something that we're hearing kind of across the board as a difficulty staffing that need. But I can tell you we have great agencies here in Weld County, and they're doing anything and everything they can to try to hire providers to serve the needs that we're letting them know. And then one other thing I want to mention is we have a few agencies locally who are willing to take kind of those shorter term kind of acute episodes of clients who just need respite for a short period of time. They do charge them a little bit more per hour, but they are able to kind of meet that need. So that's kind of a new thing that we're seeing within the last year, where kind of during the heat of the pandemic, we didn't have any providers that would do that. So that is one positive thing that we're seeing. Again, it's costing families a little bit more per respite episode, but it is happening now. So that's a positive thing that we're seeing.
Yeah, and another thing what somebody mentioned earlier is for our region, I know that our grant is not going to be able to meet the needs of our community because it just won't be enough, especially knowing that in order to entice providers to sign on to be a contractor with us, you have to find a way to pay them the right rate for it. And typically for us in our region, we try to at least exceed the Medicaid rate. So we always try to look for the Medicaid providers. So the stability in finding providers who have the staff is definitely difficult. And for those agencies. But one of the things we definitely know, and I've had to state very hard at DRCOG, is that we're going to have to be dependent on volunteers in the future in order to meet those respite needs. And those volunteers aren't going to be providing hands-on care. So they're not going to be able to meet the needs of high needs folks who need a lot more support, potentially with transferring or toileting and things like that, because that's, they're just not going to be trained to that. And I don't want to risk injuring, because most volunteers are probably going to be older adults who have the time and want to give back to the community. But we're definitely going to be highly reliant on our volunteer program when it comes to respite as well. But again, we're also only just in the development stages of starting to see what that looks like for our program.
That's great. Thank you, Erica. Let's see, I will just read Kent's comment is the biggest challenge our home care voucher respite providers are experiencing is staffing instability, which impacts their ability to provide respite. And many have upped the hourly minimums to about 4 hours, which inhibits flexibility for the family care partner. And okay, and then Ken says that sorry, can't talk right now. Here we go. We require any of our respite providers to accept the voucher as full payment. We do the same thing that Erica is talking about with their voucher providers. So that's what's going on in Colorado Springs in El Paso County. So I'm going to call on, thank you, everybody. I'm going to call on Emily and Karina to present, if that will work for you.
Yeah, perfect. Thanks, Megan. I do just want to quickly answer Teresa's question in the chat. Is there a possibility in Colorado to have respite benefit added to the DD waiver? It's a great question. So the developmental disabilities waiver includes residential and can be 24-hour residential support for a member. So because of that, respite is not available on the developmental disabilities waiver. However, we're always looking at different things, but right now it's not something that that we're considering because of that residential support that's already built into the DD waiver. Okay, let's see. Erin, do you want to add the questions to the chat, or do you just want me to go off what I already have?
Yeah, I'll add them, but also just feel free to go with what you're going with. Okay. Yeah.
I'm going to share my screen. So let's see, let me go into view mode here. Okay, so one of the questions is about what is the respite benefit in Colorado? So for those of you who are familiar with a respite benefit on the waivers, it can be really, really tricky to navigate because each waiver has respite built in a little bit differently. So I just kind of want to briefly go over these charts for everyone. I'm a visual learner, so it helps me to see it. So hopefully this will help some of you to kind of visually see it. So first, we're going to talk about the children's respite benefit. And the respite benefit is available on 3 waivers: the Children's Extensive Supports Waiver, or the CES waiver, the Children's Habilitation Residential Benefit Waiver, or CHIRP, and Children with Life-Limiting Illness Waiver, or CLLI. So the main area, as I said earlier, the main waiver that we see respite being provided at the highest rate is our Children's Extensive Support Waiver. And on that waiver, respite can be provided in 4 different ways. So we have individual respite, which would be for 10 hours or less. So that would be maybe parent needs to go to the store once a week, and respite provider comes in for a few hours to let parent go get some of those errands done, things like that. Then we have individual day, which would be up to a full 24 hours. So the child in question is getting that respite benefit for that full day. And then we have overnight group. So that would be just like it says, in a group setting. And then we have day group. And for amount of respite allowed on the CES waiver, it's 30-day units and 1,880 individual units. So that's how much respite can be requested and put into a plan for folks on the CES waiver. The difference on this waiver is that we can't approve an amount above the 30 days, 1,880 units if it's necessary for that child. So if a child is receiving respite and they need more respite than what our kind of standard benefit allows, they can make a request with their case manager to utilize an increase in respite. And in terms of location, it can be provided in the member's home, in the residence of the respite provider, or out in the community. So our CES waiver respite is really, really flexible, which I think probably contributes to why it's the waiver with the most use on respite. The Children's Habilitation Residential Benefit is very similar. It can be provided individually, just like CES in the home. The difference is it can also be provided in an individual respite residential setting. And that is because our CHIRP waiver also has kiddos in foster care. So for providers who are providing respite on the CHIRP waiver, they also need to be licensed through CDHS in order to provide that respite. And the amount is the same as CES. And then, like I said earlier, it can be provided in the foster home or in a licensed residential facility, and then in the family home or out in the community. Children with life-limiting illness waiver looks a little bit different because we're focusing more on that skilled and unskilled nursing and CNA respite, since our children with life-limiting illness waiver includes kiddos who are medically fragile or have high medical needs. And that would be 30 calendar days total. And then along with being provided in the home and community, it can also be provided in a approved respite center location. All right, so adult respite looks pretty similar across all of these waivers, but there are some unique differences that I'll just point out. For community mental health supports waiver and the elderly, blind, and disabled waiver, and the brain injury waiver, respite can also be provided in a nursing facility or an alternative care facility. So we have additional ways that respite can be provided to those members. And then amount of respite allowed is pretty similar through all of these waivers, 30 days per certification period. So that would be 30 days for each plan year. Okay. I'll stop sharing my screen. So that just kind of gives an overview of how respite looks across all our waivers. And Erin, I'm happy to send these slides if it would be helpful for folks as a more visual way to kind of see it. All right. And then our other question was around any large-scale system changes for providers, demand for services, and service availability. And this is what I'm really excited to talk about because we've been really looking over the last few years, how can we make respite more accessible to families? How can we increase how it works for families? How can we help families be better able to utilize it? So one of the changes that we're really excited about is previously the CHIRP respite was really limited in terms of how it could be provided and how much families could utilize it. So it was essentially not really being used because it was really difficult for families to access. So recently, in the last 6 months, we've adjusted that CHIRP respite to match CES. So we've expanded how it can be provided and also allow for, like I said, for families to request an increase in respite if it's necessary. We're also currently working on a proposal to add additional respite categories for CES and CHIRP, and those would be skilled respite and therapeutic respite. So one of the things that we know is, and I think Anthony kind of talked about this earlier, some folks, it's harder to care for them, right? They have higher behavior needs, higher medical needs, and it takes more of a specialized, skilled individual sometimes to provide that respite. So one of the things that we've proposed is these different categories of skilled respite and therapeutic respite with an increased rate for providers providing those services, because we recognize this takes a higher level of training, a different level of knowledge, and we want to fairly compensate providers who are providing that. So it's not finished, but we're really excited with how that could work for families and increase their ability to use respite on CES and CHIRP. And then we did have respite rates were increased 3 to 6% across all 8 waivers effective July 1st. And the specialized rates were added to Denver County since Denver County has a little bit of a different rate. Sharon, do you want to talk about the ARPA respite grant?
I do. I was just looking at the chat, and one of the projects through our ARPA, which is the, I can never remember, I had to pull it up, American Rescue Plan Act. We had funding for some respite projects, so we were able to fund some either creative or expanded ways to serve folks needing respite care. And so Damien shared Pasco's Care Match. We've helped contribute to that project, which is really exciting. The expansion that Megan mentioned at the beginning, we're helping with that one a little bit too. So those are exciting. It's neat to see creative ways to be able to use this benefit, building on what Emily mentioned, just looking at utilization, and if folks have this benefit available to them and are unable to use it, why? So part of the funding, in addition to the 12 projects that we funded across the state, we also put some funding into a landscape analysis and just dig a little bit deeper, do a lot of stakeholder work to hear more, instead of the high level anecdotal, not enough providers, all the things that we've heard today, but really dig in a little bit more and see what we can do to modernize our benefit, make it a little bit more flexible, knowing that we have to work with the federal government and how we are able to operationalize a lot of that. Know that we're working on it. We've learned a lot through the study. We're finalizing that. It will be able to be shared at some point once we get that. So this might be a great audience to share that information with. But we are trying to do what we can within the scope of Medicaid world and make this a more usable benefit for folks. So we're excited about that too.
Thanks, Karen. And I just want to chime in. I thought what Damien said was just so brilliant about, legislators are having this conversation about respite now. So, a lot of this work is just so that, we can take those steps towards having the conversation, having the understanding, and then making the changes. So yeah, it takes a lot of time and a lot of data and information.
Yep. Okay, so Damon, are you interested in speaking about your project, or
I can talk briefly. I'm an idiot as far as what all this looks like, but I know that we've been working hard with those ARPA funds, and thank you, Karen. Yeah, I think we're going to start with our own families first. Again, we're with Pasco. We're the innovators of the paid family caregiving model in Colorado 20 years ago. So respite's always a need. As we know, I've been on this for many years on this coalition. I think we have a lot of families that are probably doing this organically, saying, hey, I'll watch your kid, you watch my kid. So we have that. This will just sort of get that process. People will I kind of look at it as like a dating app for respite. That's my kind of understanding. People will get vetted, do all these things, and then if it's a good match, then we'll hook those families up. That's my understanding, kind of the very simplified. So I think we're doing beta now the next month with some of our own families and see how it works, get out some of the kinks. We have a lot of excitement around this project, so hopefully people can take this and run with it as well. So I put my email on the front. Yeah, I'd be more than willing to talk.
Thank you, Dean.
Yep.
I appreciate that. It's exciting. We're excited to see it unfold too. So here, I put your email in the chat. Okay, so let's see. Do we have any caregivers in the audience? The questions for the caregivers are, if you have a respite benefit, what types of flexibility do you need to be able to use it? And how have you gotten creative in using your benefit or helping someone to use their benefit? Is there anyone that is interested in talking about that? I don't know if we have anybody in the meeting. Well, I will move
Megan,
on.
the only thing, if no one else has anything to add, the thing I wanted to kind of tie back to was when Tia and Tabby were talking about wraparound benefits. A conversation that we have with our caregivers a lot are thinking outside of the box in terms of respite. If formal respite care is not available, what is available in your area? Like Damien said, someone and I know Jillian and a lot of respite voucher programs are moving to a self-directed model to open up those options for families and make sure that things like camps or training programs, anything that's out there that can provide a break for the caregiver where their loved one is with someone they trust. Anything that can allow them to take a break. So getting creative that way and thinking about what other benefits they need. So those wraparound services and getting creative with respite kind of go hand in hand. So
yeah, absolutely. Thank you, Erin. So I guess we just have one more set of questions, and it's to the general audience. So what new respite resources have emerged in the over the past few years, and which we just learned about? And do you have any stories you would like to share? Does anyone have something that they would like to share? A success?
Hi, this is Jillian from Weld County. I just have a really short story of a family I just started working with. They were kind of in a similar situation where their loved one was very independent, able to do a lot of things on his own, but now is experiencing some physical limitations and needing a little bit more support on a daily basis than before. But one of the things that he continued to do was go to the gym. That was kind of his outlet every day. And talking with this family, we tried to get creative because there was not a provider in that area. So they actually have his personal trainer for one of the classes that he works with, who does sparring with him in their home. And during that time, his wife is able to kind of step away. He's getting that movement, that exercise that he really enjoys from a trained individual. And they're not paying the rate that they would for the personal trainer. They're just paying it for an in-home provider. So they're able to pay him a little bit less. His personal trainer, they call it, loves meeting with him. It's kind of his outlet and time away from the office as well. So that was just kind of one success story that it's really worked for them. And we just kind of had to brainstorm on who are those informal supports that they know? How can we make this work for you? I know that's not available for every model, but at least on the respite voucher side, it was flexible enough to where that oversight was provided. The caregiver's getting a break, but in a more creative kind of sense.
That's an awesome story, Jillian. Thank you for sharing. Yeah, so I think that's it. We just have to all be more creative in how we deliver the respite. Yeah. Anyone else? Because I think we're pretty much at the end.
The story that I wanted to share really kind of highlighted that, as I spoke earlier, the gap of service. So we had a situation with our adult day where we got a phone call from a doctor's office saying that one of our family members, who was the care provider for our participant, was in a mental health crisis, burnout, and was making not only suicidal comments, but also homicidal comments. This enrolled Adult Protective Services into the situation. What we found was that there was no family supports that could be readily available to take the individual in. Care provider needed to seek mental health services and was actually put on a 72-hour observation hold. And daughter of the participant lived all the way in Wyoming and did not have the means to get here. Son lived all the way in Arizona and did not have the means to get here. APS did not have any kind of resources to be able to connect with a care center to be able to provide an emergency respite bed. And so if it wasn't for, we kept him in the center for as long as we could for the day until we were able to figure it out. It was actually the neighbors who ended up taking him in to provide that emergency respite. because they knew him well and they knew kind of what his care needs were. Then the next day we started the cycle all over again. We went and picked him up from the neighbors, and we had him all day, and as APS was scrambling to try and find that emergency respite bed that they just could not make happen. In the meantime, this individual was terrified, not understanding what's going on, and just being kind of shuffled around. And so we were finally able to secure a bed after 3 days of the neighbors taking him and us taking him in the day and the neighbors taking him at night. But we noticed that significant gap of service. And if we wouldn't have found the respite bed that we ended up finding, this individual would have landed in the ER, because that was the default that Adult Protective Services has when they can't find that emergency bed. And that further puts a strain on the ER, because you have an individual who has a diagnosis of dementia and Alzheimer's. They don't have a real medical need to be in the ER, a wanderer, so it takes up those resources as well. So I would really like for this group of amazing individuals to really look at, what does it look like to connect with care providers and these facilities to say, what would it take for you to hold open a bed for emergency respite? What would be the incentive for you to hold that bed open for those emergency crisis situations? So just something I want us to be really thinking about. And thank goodness the care provider got the assistance that she needed. She is well now. She is back in that caregiver role and is doing amazing. And so is the participant. But that immediate emergent situation that happened, I really noticed that there was a huge gap in services there when it comes to emergency respite beds.
Wow, interesting. Thank you, Tabby. I'm going to, let's see, there's one comment. How or can you access an in-home provider for respite services if I'm a parent CNA? Also respite for a child with behavioral, no medical needs except help with toileting. Just
Maybe on that one, there's a great program that we worked with the state to develop called pediatric personal care. It's not respite per se, but it would allow someone else other than a family member to come in and help with some of those tasks, kind of an extra set of hands. I think it gets trickier doing pediatric personal care and CNA, but let me put that in the chat from HICPUF.
thank you.
Mm-hmm.
Any final success stories or anything else that anyone wants to share? Okay, I really want to thank everyone for being here today, and exciting, yeah. So looking ahead in 2024, let's see, get this out of the way. So our next statewide meeting is February 7th. And so we'll have 4 quarterly meetings next year. And the link to register is right there. And I think that's it for today. Oh yes, here we go. So please feel free to email us at crcinfo@easterseals.org. We have social media channels, and let's see, and sign up for our newsletter. Anything else? Connect with somebody new or deepen the new connection you made today, and invite someone who is missing to the next meeting. Oh, Gavin had raised his hand. I'm sorry, didn't see that. Do you care to speak? Sorry.
Yes. So I was invited by Erin Myrand here. We provide a free program for physicians and home health agencies to sign the home health and hospice and DME orders online. So I have given my information here on the chat. So if any home health or caregiving facility or assisted living facility, if they're looking to manage these orders, I think for now, they are managing these orders in physical fax, which is kind of a problem for all of the agencies when it comes to signing these orders for patients. So our program lets you to capture all of the orders, sign them online, and also sort of communicate with the hospitals and clinics better through our program. So if anybody is interested, they can log into our website and raise a request, and we would be happy to address any requirements they have.
Thank you very much.
Thank you.
And I still see messages coming in. Okay. Any final things? We'll just give you back some of your time. Thank you very much, everybody. It's been very, very interesting. Thank you.
Thanks, everyone.
Thank you.